Hi, my name is Vanessa Ball. I'm an associate professor in the Karmazin and Lillard Endowed Chair in Adult Autism at the Rutgers University Graduate School of Applied and Professional Psychology. I'm here to talk to you today about autism in adulthood, which is the area of focus in my research and my clinical work, and the projects that I'm working on in my lab, which is referred to as the Lifespan Symptom Profiles, Achievements, and Needs in Autism lab here at Rutgers. So some people are surprised when I tell them that my research focuses on autism, but particularly in adulthood. And I think this is sort of because while there's a wider awareness of autism in the community, we still really think of autism as a childhood disorder. And while it's absolutely true that many individuals are identified and diagnosed as younger children, there are often a number of people who are diagnosed later in life. And in addition, even for those individuals who are diagnosed as children, the vast majority continue to exhibit difficulties that would qualify them for a diagnosis as an adult. In fact, research has really shown that autistic adults are at risk for a range of difficulties as they get older. So for example, many autistic adults have a hard time finding jobs and gainful employment. Even for someone who has a college or a graduate degree, they might have difficulty finding a job, and if they're able to find a job, might have difficulty maintaining or keeping that job. And I want to be clear, in both these situations, it's not that they don't have the technical skills needed to complete the job. In often cases, they're even more prepared than some other individuals to do that job. But instead, it's the social nuances that cause difficulty in understanding how to navigate interactions in the workplace, or sometimes it's aspects of the environment that are not adapted to best support that adult. Adults with autism are also really at risk for high rates of co-occurring psychiatric conditions like depression and anxiety. And unfortunately, research has shown that there are a real lack of services both to support specific needs like finding and maintaining employment, but also in sort of more general services like mental health treatments. And there's been a tremendous increase in autism research and understanding of autism over the last several years, but primarily this is focused on highlighting problems and needs of autistic adults and the lack of available services and supports. So one thing that doesn't get realized or highlighted as often is that just because someone's diagnosis persists into adulthood doesn't mean that they have the same difficulties as adults as they did when they were children. And so when we think of autism in childhood, we often think of symptoms like difficulty with imitation or less eye contact or gestures during a social interaction, maybe the presence of unusual behaviors like hand flapping. But in fact, what we see in several longitudinal studies, so studies that have followed individuals over several decades of their life, is that all of these different symptoms show different trajectories. And so what that means is that while some things continue to be difficult for adults, some adults show improvements in particular areas that they had difficulties in when they were children. So for example, the same person that had a hard time making eye contact or using gestures during a social interaction when they were younger may no longer have this difficulty when they're an adult. For some people, that's because these basic social communication skills have developed over time, but we also know that some autistic adults report a greater awareness of their difficulties, and they have a sort of conscious effort to counter some of these things and applying sort of learned rules in specific situations, something that's been referred to as camouflaging. And so an important difference for adults compared to what we're used to thinking about children is that many of these gains or in skills or the ability to apply specific learned rules or behaviors in a situation, because of these things, many people in the community might not recognize autism in an adult. And so I very often have interactions even with other community providers who will say like, oh, I don't think that person has autism because they made eye contact with me, or I had a back and forth conversation with that person. And some of that is just general sort of misconception of what autism is and the varied ways in which it presents, but also I think it has to do with a limited understanding of autism, particularly in adults. So in addition to ongoing development, another area that I'm really interested in my own research is understanding individual strengths. So although diagnoses are really defined by impairments and the need for supports, we also want to know more about areas that can help us to support an individual achieve their goals. So a strength really can take many different kinds of forms. I like to think of this as any skill or positive attribute, but that can particularly be sort of leveraged to help support someone address an area that's more challenging for them. So for example, I think a common strength that we often think about for many autistic people is a strength in visual processing. And this isn't for everyone, but many individuals report that things like visual support, so a picture schedule or written instructions, can be really helpful to facilitate learning and independence. But some strengths, I think, are a little bit more subtle and more context dependent. So for example, you have someone who has a lot of knowledge in a particular interest area, like animals or history, and so this might be actually impairing in the workplace if they have a hard time not talking about that interest and sharing that a high level of detail with their colleagues, and they might get in trouble if they're distracting other people or they're not getting their work done. But we can view this as a strength if we're able to put them in a situation, for example, find them a job at a museum or at a zoo where they're actually being paid to provide a high level of information or detail to people on tours of the zoo or tours of the museum. And so you might be kind of wondering, how do we figure out if someone's strengths and challenges, and how do we use that information to actually guide what kinds of interventions and supports they need? So in my research and many of the clinics that I've worked in, this usually comes in the form of what I'd call a comprehensive assessment. So a comprehensive assessment has different ways of looking at multiple dimensions of a person's behavior and skills. So we absolutely would look at autism symptoms to understand for that adult, what does their autism sort of look like, what symptoms or challenges do they have. But then we're also looking at things like language and cognitive functioning, sometimes referred to as IQ. We want to know the level of independence they have in daily life, which is referred to as adaptive functioning. We're thinking about things like executive functioning, so their ability to plan and to be organized, as well as thinking about mental health, so things like depression, anxiety, and other symptoms in that range. And then really, really importantly, asking them what are their short-term and long-term goals? What are they hoping to achieve? And I think that's a lot of different domains, so these assessments can take a number of hours, and depending on the referral question, if you're in a clinical setting, you might choose to emphasize some areas more than others. But I would argue that touching on all of these different dimensions is, on some level, is really important to get to know someone in an in-depth kind of way, and to really consider how to support them, again, to achieve their specific goals. So as I said, understanding symptoms and strengths to understand how we support autistic adults is an area that I'm particularly interested in. So in my lab right now, we have projects where we ask adults to come in, and we do these assessments using a range of different methods. So we ask them to do a range of different activities. We have them fill out questionnaires. We interview them with sort of lots of different questions. And if they're willing to and have a family member who's available, then we would often invite them to participate as well. But because we're working with adults, we also want to recognize their autonomy and their right for privacy. And so often inclusion of a family member might be an option as opposed to a requirement. Of course, it depends on this individual situation. So for some individuals who don't have spoken language or might have other difficulties that would interfere with their ability to tell us about their experiences, then we might ask a caregiver to provide some perspectives, because we don't want to risk excluding an understanding of strengths and needs just because someone isn't able to answer questions directly about themselves. So I think more and more professionals are starting to think about strengths and how we can support autistic adults in more strengths-based ways. But I think there still is a tendency to sort of look at autism as a really challenging sort of set of impairments. And I bring this up because I think that there are cases where specialized knowledge and training to work with autistic adults is important, but I also think that as a mental health community, this is something that we have to be aware that not in all cases do you need to have a high level of expertise to work with someone with autism. So for example, you might have a client who has autism and a high level of anxiety, and I might refer them to cognitive behavioral therapy, or CBT. So CBT has a strong evidence base for addressing anxiety symptoms in the general population. We also have some evidence to suggest that CBT is particularly effective for supporting autistic adults in addressing anxiety. And so sometimes if I refer an autistic adult to a community provider, I'll get a note back saying, oh, I don't really have expertise in working with individuals with autism. And I think, my sort of response is often, that for this particular individual, I really don't necessarily think that modifications have to be made for the CBT protocol. And that's more important for me to have this person see someone who has a high level of expertise in using CBT to treat anxiety. And, I can maybe provide some consultation to support and troubleshoot things that might be related to autism if modifications are needed. But I'll point out that mental health professionals, we consult on individual cases all of the time, and to kind of expand our competencies. And this would be a case in which it's more appropriate for someone to see a therapist that has a high level of expertise in CBT rather than someone with a high level of expertise in autism that then has to try to learn CBT. So just to kind of wrap up, I really hope that this video has helped you to have a better understanding of autism, particularly in adulthood, to recognize that autistic adults continue to develop and change over time. They learn new skills, and experiences will change their goals. And it's really important that we provide opportunities to make sure that we're assessing their current strengths and abilities, as well as the areas that they need more support in. And hopefully a better understanding will really hopefully lead to greater appreciation for the strengths that autistic adults bring to our communities and position us to better support them to achieve their goals and live fulfilling lives.